Correct. Thank you, Dr. Sucandi. I'm Guido Fiorentini, one of the HPB fellow at Mayo Clinic. AMILES registry was born a couple of years ago to keep track of the implementation of minimally invasive liver surgery among the North and South America. It was born as a prospective and retrospective data collection. We have more than 100 variables that are collected, and the aim of this presentation is to give to the participants, most of you are also participating in this registry, a quick shot of what we have collected so far, what we're doing so far. It's a castor-based database that every center can use also to keep track of their own centers. This is open to the entire Americas continent. So far we have one institution participating from Canada and 8 more institutions participating from across the US. And again, it's open also to more centers in Canada and especially to the South America. So far we have 1,900 centers that have been inserted, just as some snapshot on the procedure, variety of the procedure, both minor, but we are starting to see also a fair amount of major liver resection. Diagnosis, 70% are malignant disease. We can make also some consideration on benign disease, 30%. Initial approach, and I think that this is going to be a great step forward that the US will do in the next few years. We have 60% of pure lab procedure, and we are starting to see the column for robotic procedure that is becoming higher and higher. So very likely, in some way, in some years, the US will be pretty forward in comparison to the European realities in these terms, respectful to the minimal invasiveness in laparoscopic liver surgery. We have some data regarding pathology collection, use of Pringle, previous liver resection, how many patients did undergo previous ablation, conversion rates and reason for conversion rates. These are also variables that can be used and that can be applied for several studies. So far, we have 3 papers which are upcoming from what we have collected so far, and 2 more studies are being just began. So we are starting to see more and more studies performed on this database. I would like to highlight that this AMILES registry is compatible also with the Italian, the British, and the Japanese database. And let me recall that during 5 years of the Italian AMILES, more than 50 publications came out. So we hope to see more and more centers participating in liver surgery to join in this effort. Thank you.